Good afternoon. It's Arlene Avalos reporting on a serious but overlooked health issue, laryngeal cancer, cancer of the voice box. This disease can take someone's ability to speak, swallow, eat, and even breathe the way they used to. And for some families, this diagnosis becomes life-changing. So now I want to take you into the life of a laryngeal cancer survivor, my grandfather.
Empezó a ir la voz y ya con el tiempo se empezó a enronquecer más. Y él pensaba que era porque herencia de su papá, porque su papá era ronquito.
Laryngeal cancer begins when abnormal cells grow inside the voice box and form a tumor. As it expands, it interferes with the vocal cords, the airway, and even basic functions like speaking and swallowing. Early signs are subtle: a hoarse voice that never clears, throat pain, a persistent cough, or trouble swallowing, and that's why many patients are diagnosed late. By the time my grandfather finally saw specialists, his cancer had already reached stage 4. The tumor was blocking his airway, and to save his life, doctors had to remove his entire voice box. After surgery, he went through aggressive chemotherapy and radiation. Those treatments helped control the cancer but left heavy scarring, making it unsafe for him to swallow. When he first began treatment, he was already showing late-stage symptoms like difficulty breathing, neck swelling, weight loss, and ear pain. And there are warning signs no one should ignore: sudden trouble breathing, coughing up blood, being unable to swallow saliva, or loud, harsh breathing known as stridor. After losing his voice box and with all the damage from treatment, swallowing became unsafe. Food and liquids could easily go into his airway, putting him at risk for aspiration. Because of that, he needed a G-tube placed directly into his stomach, and that became his main source of nutrition, fluids, and medication. People with laryngeal cancer often struggle with dehydration, weight loss, and malnutrition, so nurses keep a close eye on weight, fluid balance, and labs like albumin and electrolytes to make sure the body stays supported. His tracheostomy is his permanent airway, so it needs daily monitoring. Redness, warmth, increased mucus, or foul-smelling secretions can signal an infection. Infection can cause swelling and make breathing harder, so removing the tracheostomy and cleaning it regularly is crucial. Even a small blockage can restrict airflow. For patients with laryngeal cancer, airway safety is always the top priority. Nurses watch for infection, check oxygen levels, and ensure the airway stays open. To diagnose laryngeal cancer, doctors use a laryngoscope to see the tumor and imaging like CT or MRI to determine its spread. Labs also guide care: a CBC for infection or anemia, a metabolic panel for hydration and nutrition, and ABGs if breathing is affected. Nurses support the entire process, preparing patients for procedures, keeping them NPO when needed, monitoring breathing afterward, and watching for bleeding or swelling.
Sentías tristeza porque ya no ibas a tener tu voz. ¿Y qué se podía hacer que ya no? Estaba muy deprimido, se agarraba llorando por la razón que él no tenía su voz. Por eso.
Non-medication care is just as important. Patients often need speech therapy to learn new ways to communicate, nutrition support because swallowing gets harder, humidified air, proper airway care, and emotional support as they adjust to losing their natural voice. A whole team helps with this: surgeons, cancer specialists, speech therapists, dietitians, respiratory therapists, and social workers. Complications can be serious. These include long-term breathing problems, aspiration, infections around the tracheostomy, dehydration, malnutrition, and heavy scarring. Some patients also deal with bleeding, airway blockages, anxiety, depression, and feeling isolated. Nurses and caregivers stay alert for early warning signs: trouble breathing, thicker mucus, fevers, or any changes that show swallowing isn't safe anymore. When it comes to risk factors, smoking is the #1 cause of laryngeal cancer. Alcohol raises the risk even more, and together, they greatly increase the chance of developing the disease. Other causes include HPV infection, poor nutrition, exposure to toxic chemicals, and chronic acid reflux. Over time, damage to the cells lining the voice box can lead them to grow uncontrollably and form a tumor.
Vayan al doctor para que vean, no les vayan a dar las mismas noticias que me dieron a mí cuando a él le dio esto. Que se atiendan pronto. que no vayan a pasar por la misma situación que él está pasando ahorita.
So if you notice a hoarse voice, difficulty swallowing, throat pains, or changes that won't go away, don't ignore them. Early testing can save your voice, your health, and your life. I'm Arlene Avalos reporting on laryngeal cancer. Thank you for watching.